Hello, good afternoon. Betty Jo Kaiser here, Talk to the Experts, and we are joined in great conversation with HeartFit Clinic's Diamond Fernandez. Welcome back, Diamond.
Thank you.
If you're just tuning in, we are hearing all about heart health and a fantastic therapy that is offered here in Calgary, the only place in Alberta offered here at HeartFit, the HeartFit Clinic in Calgary, for those people suffering with angina or diabetes. Maybe you've had stent or bypass surgery. You're going to want to stay tuned because there's some really interesting stuff, some great information regarding heart health. You can also check out their website, heartfit.ca, or give them a shout, 403-870-4348, 1-877-700-4348. So for those just tuning in, maybe, Diamond, can you just give a snapshot of what the clinic offers, a whole suite of things you guys offer?
Yeah, I'm very excited about this new treatment that we have to help people with heart disease, and it's called external counterpulsation therapy, ECP. And that really just complements everything else that we do, because you don't just come and just do this therapy. We have very accurate screening tests to see what your risk is of a heart attack or stroke. So a lot of people who want to know what their risk is of a heart attack or stroke will come in just for those assessments. But we do that thorough assessment before you start any one of our programs. So that's a really basis of where we start our services.
Yeah.
From that, we have our medical fitness programs, cardiac rehab programs, and then now we have our external counterpulsation therapy that we've been doing since the late last year there.
I think it's important to note, too, this isn't a replacement for your cardiologist or your family doctor. You guys all work together.
Absolutely. And
this is a place where you go to improve your heart health.
Absolutely.
Right?
Yeah, I mean, your family doctor is great at, doing some basic things for your health, but they're not going to obviously get more in detail. If you're concerned about the detail things and really want to know what your risk is of a heart attack or stroke, that's where the HeartFit Clinic can help you.
Fantastic.
And if you've seen your cardiologist, they just want to make sure that you're stable. And if you're stable, well, they got other high-risk patients to obviously help out that way as well.
Yeah, they're just getting you back alive.
Of course,
right?
Yeah. And they do an amazing job that way.
Of course. Yeah. And that's great. And that's one of the things I love about HeartFit is that it's they work in tandem with the doctors, with the cardiologist. And it's important, folks. I mean, heart disease is the number one killer of men and women. And over 50% of people with normal cholesterol end up with heart disease. These are shocking facts. But a lot of you out there that are listening are like, hey, I know, I have angina. My sister has angina. My brother has diabetes. Of course, we all know someone that's had stent or bypass surgery. And for those folks in particular, I want to talk about this external counterpulsation therapy because it really is one of the shining stars that is offered at your clinic. And so can you please get into the nuts and bolts of this for me, Diamond?
Yeah, it's a wonderful treatment. And the results that we're seeing from the patients now is just amazing. It's different. I used to do this treatment back when I was in Dubai in 2005 or 6 in that range there. And it was an amazing treatment then. Now, of course, doing it many years later and bringing it to the HeartFit Clinic, we're seeing great results from patients. Patients have more energy. They're able to do a lot more. They're able to not take as many medications for their angina. Those are big things. Patients that are heading maybe for a stent or bypass or trying this type of therapy beforehand. A lot of times, patients had to fly down to the States and the Mayo Clinic or Cleveland Clinic to do this form of treatment, and they don't have to do that anymore. So I'm very excited about that.
So you're really improving quality of life with this therapy.
Absolutely. And it's such a great treatment. External counterpulsation therapy has been done for years. It's been U.S. FDA approved since 2002 for congestive heart failure and angina. There are many clinics, like I said, doing it in the States and all over the world. I mean, it's a first-line therapy before stents and bypasses.
What are some of the other therapies that people might be familiar with that really should be considering ECP?
Well, there are a lot of treatments that we can do to prevent and reverse heart disease.
Right.
We're a very evidence-based clinic. We're not very, we don't do too much alternative type of care. There's chelation therapy that's available out there.
Oh, everybody's heard of that.
And, chelation therapy is where it's an IV, and it has shown to see some benefits that way, but it's not as strong. It can, and it's kind of a hit and miss type of thing that way. I've seen some good results with some patients, but I've also seen, nothing.
Right.
And it just depends, really. I think ECP therapy is an amazing therapy. It's a great therapy for patients who have angina, who have a blocked stent or bypass, who have disease, heart disease, because a stent only fixes a small section of the arterial wall. If you think about it, if you have a brand new garden hose from Canadian Tire, that's what our arteries should feel like, nice and rubbery and elastic and moving very well. You don't want it to feel like you've left it out all winter long.
It's all cracked
and
and brittle.
Cracked and crusty, where water will still flow through, but the artery or the function of that hose is not really working that well. ECP works on all your arteries in terms of your heart.
It's a workout for your arteries.
Yeah, it's a workout for your arteries. It increases blood flow. It promotes collateral circulation. It increases stem cells. A whole bunch of great benefits from that. And we can go into that a little bit later.
Yeah, actually, that's really fascinating. The blood flow, I find that interesting, and it's clear to me how that definitely helps with your heart health. How does that help folks with diabetes?
Well, with diabetes, because of the increased blood sugar and obviously the increased response from the pancreas, with ECP, with external counterpulsation therapy that we're doing at the HeartFit Clinic, it actually helps improve the artery function. Remember, the artery is a muscle.
Right.
And so your arteries should be moving well. And so we bring basically the best way I can think of it from our listeners there is taking that garden hose that's been left out all winter long and bringing it to like almost a brand new one.
Right.
So you're reversing the effects of heart disease in a way.
I am chatting, Betty Jo Kaiser here, Talk to the Experts. We are chatting with Diamond Fernandez. He's from the HeartFit Clinic, the director there. He is... He's so excited about this, about what he does. It's so awesome to see someone with such passion for other people's health. It's clear this is your thing. You want people to feel healthy, to be healthy. And the HeartFit Clinic is definitely providing that. Please check out their website, heartfit.ca. Give them a shout, 403-870-4348. 1-877-700-4348. I will fire those numbers off a couple more times within the hour, so if you haven't grabbed a pen, you will have time to do that. I just want to talk a little bit more about the blood flow and other applications. It's not just about the folks with angina or that have had the heart surgeries or diabetes. What are maybe some other applications?
Well, it does improve blood flow, obviously, because of the massive amount of blood flow back to the heart, and now it pumps it out there. It improves, obviously, the benefits to heart disease as well. But it has been shown to help out patients with with cardiovascular disease, so all-encompassing. So it could be strokes. And strokes is a very big, some really good research out there on ECP therapy and patients with stroke. So that's a very good response for that. High blood pressure. Patients, obviously, that comes with heart disease as well or stroke. It's a very important, if you have high blood pressure, yes, we're medicated. But how do we get to the root of the problem? And by improving what we call nitric oxide production inside our arteries, it allows our arteries to dilate, to expand. And that, therefore, reduces hypertension.
Awesome. Well, and your blood flows all over.
Absolutely.
Right? So it's going to affect all aspects of your body.
Yeah. And so with diabetes, it's going to help out with that. It's going to help out with patients with kidney disease, what we call, obviously peripheral artery disease. That's very important that way. And it has shown some improvements because of this. And obviously, I don't like to, per se, talk about it too much, but it's one of the benefits, and we hear from, obviously, some of our patients, it does improve libido. Obviously, improves with, and
so if there was dysfunction.
Here's a fact that a lot of our listeners may not know about. The arteries going to our sexual organs are a lot smaller than the arteries going to our heart.
Okay.
And so if you're having, obviously, sexual dysfunction, if we can improve blood flow, that's why we know exercise is very good. And yes, there's some nice pills out there that we can take to improve that right away.
Right.
But that's what ECP does. It helps dilate the blood vessels, improves blood flow to all areas.
I'm just reading some information on it. It also improves sleep. It's people that are able to benefit from the ECP or external counterpulsation therapy that is offered at the HeartFit Clinic here in Calgary. Patients experience way deeper, better sleep.
Way better sleep, increased stamina. That's really great benefits. I mean, we're doing pre and post assessments on our patients, and we're seeing really, really great benefits. They're improving times on our treadmill tests. They're improving what we call the inner lining of the arterial wall. We have a test to see how healthy or how reactive your arteries are. So we're seeing great improvements that way. And it doesn't happen just from obviously doing some other things. And with our treatment, when we're doing our treatment, we talk a lot about nutrition. We talk about stress management. We talk about how they should exercise safely and effectively. Because this is just a small course of treatment. the benefits, according to the research, last up to about 5 years.
Wow.
And so it's really great. And we've heard, obviously, a lot longer than that. We've just heard about a patient who had it 10 years ago, and they're still obviously doing very, very well with it.
Oh, that's fantastic. We are discussing external counterpulsation therapy. It is available here in Calgary at the HeartFit Clinic, the only place in Alberta that offers it. And Diamond Fernandez, the director of HeartFit Clinic, is joining us today on Talk to the Experts. I'm Betty Jo Kaiser. If you would like to just check out their website, it's heartfit.ca. Number 403-870-4348 or 1-877-700-4348. This is Talk to the Experts on News Talk 770, and we'll be back after this.